I'm Dr. Jane Wilcox. I'm the Associate Chief of Cardiology here at Northwestern Medicine and the Medical Director for our Center for Heart Failure.
I'm Duc Thinh Pham, Cardiac Surgeon at Northwestern Medicine and Surgical Director of the Transplant and Mechanical Assist Program.
We have a comprehensive center for heart failure at Northwestern Medicine. Part of that is our heart transplant program. We have state-of-the-art procurement techniques. We really keep the patients at the center throughout the entire process. It starts with a phone call, so the patient or the doctor can get an actual live person right away and speak with somebody about their condition or their loved one's condition. We then collect records from the local physician, and we then do our formal evaluation. That often includes local testing, a telehealth visit with one of our doctors, and then an in-person visit with myself and Dr. Pham to really understand what's best for you and your family.
So for patients who are out of state, we have the capability of reviewing a lot of these testings beforehand and then setting up a virtual visit with the patients. Then when they're ready to come for their full visit, we try to make it as quick and seamless as possible. Once we fully evaluated the patient and decided that transplantation is the best therapy for that patient, he or she is placed on the waiting list. We're able to find the right match for the patient. The surgery itself takes typically about 6 to 12 hours. If everything goes smoothly, the patient is in the intensive care unit for 1 or 2 weeks, and then another week or so in the hospital and hopefully discharged to home and back into the community. Following the heart transplantation, our patients are cared for by an army of clinicians. We bring on all the consultants that are needed to make sure that the patient's outcome is the best that it can be, and the stay at the hospital is as short as it can be as well.
Our social work team is adept at FMLA paperwork, helping patients navigate the system in terms of choosing appropriate insurance coverage. We really focus on the comprehensive care of that patient before transplant, during transplant, and then follow up. Within the first year after heart transplant, it's a busy time. That's the highest risk for rejection or infection. We do whatever testing is needed, whether that's an ultrasound, an echocardiogram, laboratory testing, an in-person office visit with your local provider as much as possible.
Our main goal is to have the patients out in the community with their families as much as possible.
And to really be living a full life within 3 months after heart transplantation. We always consider our transplant patients family, and so we're keeping an eye on them with yearly visits, as well as we follow our patients in a registry. And sometimes patients, contact us later on if they're interested in a clinical trial, or they just want to get together at our yearly picnic. So we never lose sight of the patient.
Once you're my patient, you're always my patient.
What makes me passionate personally about heart care, and I think what drives our team, is our patients. We see that this is a really vulnerable time for them, and that is something that we don't take lightly. It is a really tough time for patients and families, and they are looking for a home, they're looking for trust and hope, and that's something that we are very honored and humbled to be able to provide.